How can you cope with someone being a pathological liar? Pathological lying is when someone lies a lot, like all the time. It's not the usual little lies we tell to be nice or avoid problems. Pathological liars just lie for no clear reason, which can be confusing and frustrating. People have known about this for a long time, but there isn't a single definition for it that everyone agrees on. Some people who lie pathologically might have a mental condition like antisocial personality disorder, while others don't seem to have a medical reason for lying so much. So, what is a pathological liar? A pathological liar is someone who lies a lot, and we don't fully understand why they do it. They might lie to make themselves look good, to be liked, or to get sympathy. Some evidence suggests that issues with the central nervous system, personality disorders like antisocial personality disorder, trauma, head injuries, or hormonal imbalances might contribute to this behavior. A study from 2016 found that the more a person lies, the easier it becomes, and it may be driven by self-interest. While this study didn't focus on pathological lying specifically, it might help us understand why pathological liars lie so much. The following are some recognized traits and characteristics of pathological liars based on scientific understanding. Trait number 1. Their lies seem to have no clear benefit. When someone lies, it's usually to dodge a tough situation like feeling embarrassed or getting into trouble. But a pathological liar tells lies without any clear reason or advantage. This can be really annoying for friends and family because the person lying isn't gaining anything from their lies. Trait number 2. The stories they tell are usually dramatic, complicated, and detailed. People who tell a lot of lies can be really good at making up stories. They make their lies sound very detailed and interesting. Even though it's clear they're exaggerating a lot, they can still be pretty convincing. Trait number 3. They usually portray themselves as the hero or victim. People who tell a lot of lies often make themselves out to be either the hero or the victim in their stories. They usually lie to get people to admire them, feel sorry for them, or accept them. Trait number 4. They sometimes seem to believe the lies they tell. A pathological liar is someone who tells a lot of lies and stories. They lie so much that they might start to believe their own lies. It's tricky to deal with them because they may not even realize they're lying. Some experts think they lose track of what's true and what's made up. Pathological liars are good at talking to people. They're smooth and creative, and they can think on their feet. Unlike typical liars who might pause or avoid eye contact, these liars seem confident. When you ask them questions, they might talk a lot without really answering the question directly. So, what is the difference between pathological lies and white lies? Many people tell lies sometimes. Research says we tell around 1.65 lies each day, mostly small ones called white lies. But there are some people who lie a lot, all the time. These are called pathological lies. They don't seem to have a good reason and keep happening. White lies are sometimes okay. 1. They are not harmful. 2. There are no bad intentions behind them. And 3. White lies are told to be kind or avoid trouble. Examples of white lies are 1. Saying you have a headache to skip a meeting. 2. Saying you paid the phone bill when you forgot. And 3. Making up a reason for being late to work. On the other hand, pathological lies are when someone 1. A pathological liar tells lots of lies all the time like it's a habit. 2. A pathological liar lies without any clear reason or benefit. 3. A pathological liar keeps on lying without stopping. 4. A pathological liar lies to make themselves look like a hero or a victim. And 5. A pathological liar doesn't feel guilty or worried about getting caught. Examples of pathological lying include 1. making up stories about achievements or experiences that never happened. 2. Pretending to have a serious illness they don't actually have. And 3. Telling lies to impress people, like saying they're connected to a famous person. So, how to identify a pathological liar in your life? Spotting a person who tells a lot of lies can be tricky. Sometimes we might be suspicious when something seems too good to be true, but not all lies are super exaggerated. Pathological liars also tell regular lies that someone who doesn't feel a strong need to lie might tell. Here are some signs that can help you recognize a pathological liar. 1. They often talk about experiences and achievements where they seem like a hero. 2. They frequently portray themselves as victims in their stories, seeking sympathy. 3. Their stories are detailed and elaborate. 4. When you ask them questions, they respond quickly and with a lot of details, but the answers are usually vague and don't really address the question. And 5. They might have different versions of the same story because they forget the details over time. So, how to cope with a pathological liar? Dealing with a pathological liar can be really frustrating since their lies seem to have no clear purpose. It can strain trust in relationships and make even simple conversations challenging. Here are some tips for handling a conversation with a pathological liar. 1. Stay calm. It's crucial not to lose your temper when confronting a pathological liar. Be firm, but also supportive and kind. 2. Expect denial. Pathological liars often respond with more lies when confronted. They may deny lying and even become upset or angry at the accusation. 3. It's not about you. Try not to take the lying personally. Pathological lying may be driven by underlying issues like a personality disorder, anxiety, or low self-esteem. Remember, it's not about you. 4. Be supportive. When discussing their lies, reassure them that they don't have to impress you with false stories. Let them know that you value and appreciate them for who they truly are. 5. Don't engage. When you notice them lying, avoid getting involved. You can question what they're saying, which might prompt them to stop the lie. Alternatively, let them know you don't want to continue the conversation when they're being dishonest. And 6. Suggest professional help. Without judgment, suggest they consider professional help, expressing genuine concern for their well-being. Provide information on pathological lying, like a printed article or pamphlet, and mention that you're worried it might be linked to an underlying medical condition. So, why do pathological liars fascinate people? A pathological liar is like a skilled storyteller and performer. They excel at captivating their audience with detailed and fantastic stories, delivered in a very animated way. People are not only drawn to their storytelling abilities, but also intrigued by the motivation behind their lies. It's common to wonder why they lie, especially when there doesn't seem to be an obvious reason for their untruths. So, how to diagnose a pathological liar? Figuring out if someone is a pathological liar can be tricky because there are many reasons why a person might lie. Just talking to them and looking into their medical history is usually not enough to be sure about the diagnosis because they have a habit of not telling the truth. A crucial part of identifying a pathological liar is figuring out if they know they are lying or if they really believe the lies they tell. Some experts use a lie detector test, also known as a polygraph. The purpose is not to catch them in a lie, but to see how well they can deceive the test. This helps understand if they genuinely believe their lies or have become skilled at convincing others. In some cases, professionals also talk to the person's family and friends to get a better understanding when diagnosing a pathological liar. So, how to treat pathological lying? The treatment for pathological lying depends on whether it's a sign of another mental health problem. If it is, therapy, which involves talking with a mental health professional, would be a common part of treatment. In some cases, medication might also be recommended, especially if there are other issues like anxiety or depression that could be contributing to the lying behavior. So, the takeaway is to empathize and cope with a pathological liar. It's important to try to understand the reasons behind their lying and offer support. Recognize that the lying may be a sign of an underlying problem that can be addressed. Encourage the person to seek the necessary help and support to deal with the issues leading to the lying behavior. Thank you for watching. Don't forget to like, comment, and subscribe. Watch more videos by clicking on this video right over here.